Hello everyone. Today our video will focus on vaginitis and sexually transmitted diseases, which are the key topics for the USMLE. We will start with a concise summary of their presentations, the diagnosis and treatment, giving you the key information that would make you confident in approaching these type of questions. And at the end, we'll go through two USMLE style questions to test your understanding and reinforce the knowledge. Okay, so the first one is bacterial vaginosis, which is caused by Gardnerella vaginalis. Here, the patients present with a complaint of a vaginal discharge, which is gray, off-white, and it's malodorous. Sometimes patients can be very specific and tell you that the vaginal discharge smells very fishy. And for the diagnostic criteria, there's the AMSEL criteria, in which there are 4 criteria mentioned, and at least 3 of them should be present. Number 1 is a thin white yellow homogeneous discharge. Number 2 is clue cells seen on a wet mount under the microscope. Number 3 is vaginal pH of over 4.5. Now, the normal vaginal pH is between 4 to 4.5, and in some books you can find from 3.8 to 4.5. The fourth criteria is a positive VIF test, which means that when potassium hydroxide is added to the vaginal discharge, a fishy odor is produced. And the treatment is metronidazole. The second one is vulvovaginal candidiasis, which is caused by Candida albicans. Now here patients complain of a thick white vaginal discharge, which is like a curd, and it has no smell, it's odorless. They can also complain of itchiness and soreness. For the diagnosis is of course made based on the clinical history and the clinical examination. The pH will be normal. In candidiasis, the pH is often normal, it's not affected. And in a wet mount under the microscope, pseudohypha can be seen. The treatment is an antifungal treatment depending on the doctor's choice. Fluconazole can be given, clotrimazole, miconazole. The third one is trichomoniasis, which is called by Trichomonas vaginalis. Here the patients present with dysuria and burning sensation. They complain of a vaginal discharge, which is green and it's malodorous. The vaginal pH is more than 4.5. It can be between 5 to 6. And on a wet mount under the microscope, you can see motile trichomonads. When the cervix is examined, it looks like a strawberry cervix, and that's because there's patches of dilated capillaries on the cervix, and you can also see erythema around the vulvovagina. And the treatment is metronidazole. So the fourth one here is herpes, which is caused by herpes simplex virus 2. And the patients present with dysuria and painful vesicles and ulcerations. Now here the term painful is the key word, which is sometimes used in the exam to direct students towards the diagnosis of herpes, because herpes is painful ulcerations. And these patients can also present with non-specific symptomatic symptoms such as fever, malaise, and lymphadenopathy. The diagnosis is made based on the viral culture, PCR, serological testing, and a Zank smear, which show multinucleated giant cells. The treatment is acyclovir. Now for chlamydia, it is caused by Chlamydia trachomatis. Often these patients are asymptomatic, but sometimes they can present with dysuria and cervicitis. It can lead to pelvic inflammatory disease, and usually these patients are co-infected with Neisseria gonorrhea. Now, under the microscope, cytoplasmic inclusions are seen, but the gold standard of diagnosis is doing a PCR or a nucleic acid amplification test, and the treatment is doxycycline and azithromycin. Now, for the gonorrhea, it is caused by Neisseria gonorrhea, and the patients, they present with dysuria and urinary frequency. They often have discharge as well, which they describe as a purulent yellow-green discharge, and this can also lead to pelvic inflammatory disease. And for the gram stain of the cervical swab, you can see gram-negative kidney-shaped diplococci, and the treatment is ceftriaxone. For syphilis, it is caused by Treponema pallidum. Now, the presentation of the syphilis depends on which stage it is. If it's the primary stage, it presents with a painless genital ulceration. This term, this word, painless, is very often used in the exam as well to give clue to the students that the diagnosis is pointing towards syphilis, because if it was painful, it would be herpes, but now it is painless, so it is syphilis. And in the secondary phase, the patients will have maculopapular rash, which is usually it's a rash that it will involve the palms and the soles, and they can have condylomata lata, which is like a smooth, painless wart-like lesion on their genital area, and a patchy alopecia. And in the tertiary phase, it can present with cardiovascular symptoms, cardiovascular effect like affecting the aorta, causing aortic aneurysm and regurgitation. It can even affect the nervous system, causing granulomatous guamas and neurosyphilis. And under the microscope, you can see a spiral organism, but the confirmatory test is doing a fluorescent treponemal antibody absorption. And the treatment is penicillin. Let's have a look at the first question. A 30-year-old woman presents with concerns about vaginal discharge. She is sexually active and uses an intrauterine device for contraception. Physical examination with a speculum reveals a copious amount of malodorous white discharge. The vaginal pH is measured at 5.8, and a whiff test performed with potassium hydroxide produces a positive result. Microscopic examination shows the presence of clue cells. What is the most appropriate treatment for this condition? A. Ceftriaxone, B. Doxycycline, C. Metronidazole, D. Clotrimazole, E. Vaginal douching. Now the correct answer here is C. Metronidazole. This is the treatment of choice because this patient has bacterial vaginosis. If you notice in this question, the patient is meeting the AMSEL's criteria by having a malodorous white discharge, and the pH is 5.8. That means it is more than 4.5, and the whiff test is positive, and under the microscope, clue cells can be seen. Hence, the correct answer here would be C, as the treatment for bacterial vaginosis is metronidazole. Option A is incorrect because ceftriaxone is used for treatment of gonorrhea. Option B is incorrect because doxycycline is used for the treatment of chlamydia. Option D is incorrect because clotrimazole is used for the treatment of vulvovaginal candidiasis. And option E is incorrect because vaginal douching is not a treatment for any infection. In fact, it can even worsen bacterial vaginosis by disrupting the vaginal microbiome and increasing the risk of complications. Let's have a look at the second question. A 30-year-old patient presents to the clinic with a 5-day history of vaginal itching and an abnormal discharge. As part of the diagnostic evaluation, a sample of vaginal secretions is analyzed under the microscope. Based on the findings, which of the following physical examination signs is most likely to be observed in this patient? A. A copious frothy greenish vaginal discharge. B. A cottage cheese vaginal discharge. C. A fishy smelling thin gray watery vaginal discharge. D. A painless ulcerated lesion. E. multiple painful vesicular lesion on the labia. Now, in this image provided, the diagnostic clue lies in the wet mount preparation, which is showing pseudohypha with prominent cell walls. The correct option here would be B, a cottage cheesy vaginal discharge, because this patient has Candida albicans infection, and the clue is because the wet mount reveals pseudohypha with prominent cell walls, which is the hallmark of candidiasis, and clinically it presents with a thick, white, clumpy, cottage cheese-like discharge, and it's often accompanied by itching and irritation. Let's have a look at why the other options are incorrect. Option A is incorrect because a copious, frothy, greenish vaginal discharge describes trichomoniasis, which is caused by Trichomonas vaginalis. And on the microscopy, you would see a flagellated, motile, piriform organism. And option C is incorrect because a fishy smelling thin gray watery vaginal discharge is characteristic of bacterial vaginosis, and you would see clue cells on the wet mount. And option D is incorrect because a painless ulcerated lesion is characteristic of syphilis, and under the dark field microscopy you would see spiral organisms. And option E is incorrect because multiple painful vesicular lesions on the labia is characteristic of herpes virus infection, and you would see inclusion bodies or multinucleated giant cells on a Zank smear.